Video provided by diabeticsupply.com. This video will go over everything you need to know about Qvar Redihaler inhaler. 1. What is Qvar Redihaler and what is it used for? Qvar Redihaler is an inhalation medication that contains the active ingredient beclomethasone dipropionate. It belongs to a class of drugs called corticosteroids and is used to prevent and control symptoms of asthma, such as wheezing, shortness of breath, and coughing. Qvar Redihaler helps reduce inflammation in the airways, making it easier to breathe. 2. How does Qvar Redihaler work to treat asthma? Qvar Redihaler works by delivering a corticosteroid directly into the lungs. The beclomethasone dipropionate in Qvar Redihaler reduces inflammation in the airways, which is a key factor in asthma. By reducing inflammation, Qvar Redihaler helps to decrease the frequency and severity of asthma symptoms. 3. What are the active ingredients in Qvar Redihaler? The active ingredient in Qvar Redihaler is beclomethasone dipropionate. It is a synthetic corticosteroid that has anti-inflammatory properties. Each dose of Qvar Redihaler delivers a specific amount of beclomethasone dipropionate into the lungs. 4. How should I use the Qvar Redihaler inhaler? To use the Qvar Redihaler inhaler, follow these steps. 1. Shake the inhaler well before each use. 2. Exhale fully, away from the inhaler. 3. Place the inhaler mouthpiece in your mouth, closing your lips tightly around it. 4. Breathe in deeply and forcefully through your mouth while pressing down firmly on the canister to release the medication. 5. Hold your breath for a few seconds, then remove the inhaler from your mouth and exhale slowly. 6. Rinse your mouth with water after each use to minimize the risk of developing oral thrush. 5. How often should I use Qvar Redihaler? The dosing instructions for Qvar Redihaler may vary depending on your individual condition and your healthcare provider's recommendations. Typically, for adults and children 12 years and older, the recommended starting dose is usually 40 to 160 micrograms twice daily. Your healthcare provider will determine the most appropriate dose for you based on your asthma severity and response to treatment. 6. Can I use Qvar Redihaler as a rescue inhaler during asthma attacks? No, Qvar Redihaler is not intended for use as a rescue inhaler during asthma attacks. It is a maintenance medication used to prevent asthma symptoms and should be used regularly as prescribed by your healthcare provider. If you experience an asthma attack, you should have a separate short-acting bronchodilator inhaler, rescue inhaler, prescribed by your doctor to provide immediate relief. 7. What should I do if I miss a dose of Qvar Redihaler? If you miss a dose of Qvar Redihaler, take it as soon as you remember. However, if it is almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to make up for a missed one. 8. Are there any potential side effects of using Qvar Redihaler? Like any medication, Qvar Redihaler may cause side effects. Common side effects may include headache, throat irritation, hoarseness, cough, and fungal infections in the mouth and throat, oral thrush. These side effects are usually mild and improve with time. However, if you experience persistent or severe side effects, inform your healthcare provider. 9. Can Qvar Redihaler interact with other medications I'm taking? Qvar Redihaler may interact with certain medications, so it's important to inform your healthcare provider about all the medications you are currently taking. Be sure to mention prescription drugs, over-the-counter medications, and any herbal supplements. Some medications that may interact with Qvar Redihaler include other corticosteroids, antifungal medications, such as ketoconazole, and certain HIV medications. Your healthcare provider can assess potential interactions and adjust your treatment plan accordingly. 10. Is it safe to use Qvar Redihaler during pregnancy or while breastfeeding? If you are pregnant, planning to become pregnant, or breastfeeding, it is important to discuss the use of Qvar Redihaler with your healthcare provider. While studies have not shown significant risks associated with the use of beclomethasone dipropionate during pregnancy or breastfeeding, your healthcare provider will evaluate the potential benefits and risks in your specific situation and provide guidance on whether it is safe for you to use Qvar Redihaler. 11. Can children use Qvar Redihaler? Yes, Qvar Redihaler can be used in children. The dosage and administration for children will depend on their age, weight, and severity of asthma. It is important to follow the dosing instructions provided by your healthcare provider specifically for children. 12. How long does it take for Qvar Redihaler to start working? The onset of action of Qvar Redihaler may vary among individuals. It may take several days to weeks of regular use for the full effects of Qvar Redihaler to be noticeable. It is important to use Qvar Redihaler consistently and as prescribed by your healthcare provider to achieve optimal results. 13. How long should I continue using Qvar Redihaler? The duration of Qvar Redihaler usage should be determined by your healthcare provider based on your individual condition. It is important to follow their guidance and continue using Qvar Redihaler as long as it provides benefit in preventing and managing your asthma symptoms. Abruptly discontinuing the medication without medical supervision is not recommended, as it can lead to worsening symptoms. 14. Can Qvar Redihaler be used for other respiratory conditions besides asthma? Qvar Redihaler is primarily indicated for the prevention and control of asthma symptoms. Its safety and effectiveness for other respiratory conditions have not been established. It is important to use Qvar Redihaler only as prescribed by your healthcare provider and for the approved indications. 15. How should I store the Qvar Redihaler inhaler? Qvar Redihaler should be stored at room temperature, away from moisture, heat, and direct sunlight. Avoid exposing the inhaler to extreme temperatures. Keep it out of reach of children and pets. The expiration date on the inhaler packaging should be checked, and if it has expired, a new inhaler should be obtained. It's important to follow the specific storage instructions provided with the medication and consult your pharmacist if you have any further questions or concerns. Thanks for watching. iBuyDiabeticSupply.com.